feeling a little down, maybe even depressed since your bariatric surgery? Did you know that depression and anxiety are the most common mental health conditions in the world? What you choose to eat is more important than ever after surgery if you're dealing with these feelings. Why? Because certain foods like fish can help. Let's talk about fish as a brain multivitamin for mental health coming up.
Get ready for the holidays and New Year. ProCare has a new multivitamin soft chew that comes with 3 delicious fruit flavors. With flexible dosing, you can accommodate your whole family's vitamin needs, and it even includes iron. Paired with calcium chews and our new protein powder. Visit ProCareNow.com and use code Susan10 to save 10%.
Hi, I'm registered dietitian nutritionist Dr. Susan Mitchell, ex-radio dietitian turned podcaster. You're listening to the Bariatric Surgery Success podcast, episode number 119. Let's cut through the nutrition and health hype today. I want you to have accurate nutrition information you can count on. I want you to feel well every single day. Get out there. Do the things you want to do. This podcast is for you. Did you catch that statistic a minute ago stating that depression and anxiety are the most common mental health issues in the world? And did you know that twice as many women as men are affected? What happens when you're feeling depressed or anxious? Do you find that some of the things you always do for your self-care, particularly prepping and eating nutrition-packed foods, kind of gets kicked to the curb? Don't miss this. Come close. If you're dealing with depression, what you choose to eat influences your mental health. And research has shown that seafood is brain food. Okay, what does this mean exactly? Those feelings of anxiety and stress can be eased by regular consumption of fish. Today, I'm including both fish and shellfish under the term fish. What's the operative word here? Regular consumption. More on this in a minute. But this by no means negates the benefits of sleep, rest, connecting with your friends and family, and physical activity on good mental health. These specific food choices, and we're talking about fish, are just one more tool in your toolbox for physical and mental health. Well, we know it takes time to change how you eat, right? Doesn't just happen overnight, although that sure would be nice, wouldn't it? And it also takes time, a few weeks or more, to notice and feel improvements from the changes that you've made. Today, I'm focusing on fish, which is bariatric friendly because of the evidence-based research pointing to benefits. And let's look at those a little bit closer. Research indicates that the omega-3 fatty acids found in fish can reduce risk of depression along with arthritis and dementia. Specifically, did you know that people who eat fish regularly, and regularly I'm saying 2 times a week, or that's 8 to 12 ounces total, you're 20% less likely than peers to have depression. Most people don't consume near enough omega-3s. Well, where do you find them? Where do you find these omega-3s? Fattier fish have higher levels of omega-3s, and they include fish like anchovies, sardines, herring, salmon, albacore and bluefin tuna, sea bass, whitefish. There are 2 main fatty acids in fish that I want you to hear about and know about. The first one is EPA, or get ready for this, eicosapentaenoic acid. The other one is DHA, or docosahexaenoic acid. EPA and DHA are in that family that we're talking about known as omega-3s. For example, 3 ounces of canned albacore white tuna contains about 2.5 grams of fat, which includes EPA about 200 milligrams and DHA about 500 milligrams. So here's this budget-friendly 3 to 5 ounce serving from a can or a pouch several times a week that easily hits the mark. So fish acts like a multivitamin for your brain. Don't you love it? More than just an excellent source of lean protein and vitamin B12 and omega-3 fats, Fish also delivers vitamins and minerals important for mental health and that tend to be low in folks who are depressed, including vitamin D, zinc, selenium, and magnesium. And bonus, don't miss this, did you know that these nutrients found in fish may also improve the response to antidepressants if you happen to take one? Well, here's what I want you to do this week. So if you're multitasking, listen closely. How does your diet rate in terms of seafood as brain food? Are you consuming fish twice a week? Answer honestly. Now, if you're allergic to fish, this does not apply to you. I realize that. I want you to add a couple of fish servings to your diet this week. What are you going to add? Remember, some of the fish containing the highest level of omega-3s include anchovies, sardines, herring, salmon, albacore, and bluefish tuna, trout, whitefish, and sea bass. So think about, what do you have? What can you pick up? What do you like? What are you going to add to your diet? How are you going to prep it? Stay focused on your journey. You are so worth it.
Bariatric Surgery Success with dietitian Dr. Susan Mitchell is produced and owned by Practicalories, LLC. All rights reserved. Remember, the content provided on this podcast is for information purposes only and doesn't create a patient-provider relationship. It's intended to provide reference material and is not designed to provide medical advice. Please consult your healthcare provider regarding any medical issues you have relating to symptoms, conditions, diseases, diagnosis, treatments, and side effects. Podcast guests express their own opinions, experience, and conclusions which do not necessarily reflect or agree with the host, Dr. Susan Mitchell or Practicalories, LLC.